Good afternoon, everyone. This is Saro Arakelians, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Today, I want to discuss some of the heart failure medications, as many of you guys may be familiar, but I want to categorize and list these categories of drugs that are used for heart failure. And this is based on the American College of Cardiology recommendations, what medications the patient should be on when it comes to heart failure management. Again, many of these options are dependent on the patient's age, gender, ethnicity, their stage of heart failure, whether they're in the late stages of heart failure or earlier stages. The treatment and the dosing for these medications might differ. So it's important for the patients to be diagnosed correctly and to be put on correct medications accordingly. So here is a list of medications, and I'll go over in the details of the listing of the medications. But mainly, there are ACE inhibitors and ARBs. There is commonly prescribed ARBs that I'm going to go over. There is sacubitril valsartan, which is Entresto, beta blockers, aldosterone antagonists, vasodilators, diuretics. Obviously, there are different types of diuretics, but in general, diuretics are used for heart failure patients to get rid of excess fluids and other heart failure medications. I have another video that goes over how these medications work specifically, but in this video, I just want to list the main medications in each category for heart failure. So ACE inhibitors. The most commonly used ACE inhibitors include captopril, Capoten, enalapril, Vasotec, fosinopril, monopril, lisinopril, perindopril, quinapril, ramipril, which is Altace, trandopril, benazepril, and moxapril. Some of these medications, the names might be more familiar than the others for you, but again, this is all the ACE inhibitors that end with pril in their names, and they're used for heart failure management as well. Commonly prescribed ARBs include candesartan, Atagant, losartan, Cozar, and valsartan Diovan. There is azilsartan and irbesartan also in this category, but these are the most commonly used ARBs. Obviously, losartan being the weakest ARB. If the patients you put the patient on losartan and the patient doesn't get any benefits from the or big enough impact on their blood heart failure control, then they should be either take a higher dose of losartan, the maximum dose, or be switched to another ARB. Then we have sacubitril valsartan, which is a combination of Diovan, obviously, valsartan, which is a Diovan and ARB, and sacubitril, which is a neprilysin inhibitor. The brand name is called Entresto. It comes in 3 different dosing. Again, in my other video, I go over the details of how Entresto works. Beta blockers, obviously, bisoprolol is a beta, carvedilol Corleg, lebedolol, metoprolol which is Soprolol XL. Also comes in sprinkle format called Capspargo, I'm sorry, metoprolol tartrate, which is Lopressor, nebivolol, propranolol, and propranolol different types, Inderal, Inderal LA, and Inopran XL. Then we have the aldosterone antagonists. These are the examples would be spironolactone, aldactone, eplerenone, or Inspra. Then we have the SGLT2 inhibitors, which are recently have been on the news with the guidelines for helping with heart failure, such as dapagliflozin, Farxiga, empagliflozin, Jardiance, sotagliflozin, Inpefa. Then we have vasodilators that help vasodilate the vessels, so you get better blood flow to the heart. Hydralazine and sorbite dinitrate. We have diuretics, which include furosemide, obviously, Lasix, bumetanide, Bumix, torsemide, Demodex, and metolazone xaroxylin, chlorothiazide diuryl, amiloride midamor, chlorothalidone hygrotone, hydrochlorothiazide, or hydrodiryl, indapamide lozole, and triamterene diurenium. Again, these are different categories of the diuretics, but again, they belong to an umbrella class of diuretics altogether. We also have other heart failure medications that could be used, including ivabradine, Corlanor, digoxin, lanoxin for rate control, and vericiguat, Verquvo. Some of these medications, including ivabradine, Verquvo, or vericiguat, are basically new medications approved in the market. Not super new, but new enough, more than the ACE, ARBs, regular beta blockers. And their use might be limited, but certainly helps with specific patients that they're prescribed for. So again, heart failure medications, their categories and the listing of them. If you're wondering what are these categories used for heart failure, these are the main categories of heart failure medications: ACE inhibitors, ARBs, which should not be taken, by the way, together. Sacubitril, valsartan, Entresto combination. Again, if the patients are on Entresto, they shouldn't be on another ARB, or they shouldn't be on another ACE inhibitor. Beta blockers, aldosterone antagonist, as you see over here, spironolactone, eplerenone, vasodilators such as hydralazine and isosorbide dinitrate, diuretics, which I mentioned, the main most commonly ones used are Lasix, bumetanide, Bumex, torsemide, chlorothalidone. I have in a couple of other videos comparing these diuretics together and their equivalent dosing. You may refer to those other videos. And we have other heart failure medications such as ivabradine, Corlanor, vericiguat, Verquvo, and digoxin or lanoxin. Again, based on the patient's condition of heart failure, and what stage they're in, stage 4 or stage 3, based on the reduced ejection fraction or preserved ejection fraction, each patient should be prescribed a specific combination of these medications for their heart failure control. It's very important also to remember, when you put the patient on these medications, you should be monitoring the patients, their ejection fraction, their symptoms, and increase the dose and to the max tolerable dosing for the best heart failure outcome. For more detailed information on these medications and the use of them, and especially heart failure guidelines, refer to the American College of Cardiology website, which they go over many of these medications in regards to heart failure management to the best clinical outcomes, and symptom control for the patients. If you have any questions on these medications, make sure to comment on the video with your questions, and I'll be happy to answer any questions you may have on heart failure management and heart failure medications. Hope you enjoyed this video. As always, stay safe and take your medications.